Thank you all for joining us this evening for the Walk for PKD kickoff for the 2021 season. We are so glad that you have taken some time out to join us this evening. It is my pleasure to get to introduce Andy Betts, President and CEO of the PKD Foundation.
Yes, thank you, Sue, and it's a privilege to be here. I'm just going to say a few words and obviously welcome you to the Zoom call today, so you can learn more information about what we're going to do in the 2021 walk. So at the PKD Foundation, as I'm sure you're all aware, our vision is to end PKD. And so to achieve this, more PKD research is needed. Over the last 40 years, we've evolved not just from being a funder, but now a doer of research. So since 1982, we've proudly funded more than $50 million going towards PKD research, and that has helped us also leverage an extra $1.5 billion in government funding for PKD research labs. Our grant and fellowship program improves disease understanding, and that helps us to drive towards new treatments. We've increased our grant funding by 230% in the last 5 years. We appreciate everything that you're doing and your energy. We couldn't do the work without you. And we certainly can do our work even without our sponsors. And so I just want to thank our national presenting sponsor for this year, which is OTSCA, and introduce Jill Green, who is the Senior Medical Science Liaison at OTSCA. Jill.
Hello, PKD community. This is Jill Green, a medical educator at OTSCA Pharmaceuticals. And although my professional journey began with OTSCA about 3.5 years ago, personally, PKD has been a part of my life for as long as I can remember. PKD actually runs in my family, and we have walked through all aspects of PKD, from diagnosis to kidney failure and dialysis, to even me being able to donate a kidney to my mother who has PKD last fall. As a family, we have seen the ups and downs and all of the physical and emotional challenges of PKD, but like so many of you, we've persevered. And as a family, we became educated and empowered, and we continue to advocate. And one of our favorite ways to raise awareness and inspire others is by participating in local PKD walks. The Walk for PKD not only raises those important funds to advance the field of PKD research, but it elevates the voice of so many PKD families and provides that much needed sense of community. My first walk in Central Ohio was back in 2007 when it was just my husband and I, but now my kiddos get in on the fun too. So OTSCA has been that proud national sponsor of the Walk for PKD for more than a decade. And although we cannot physically walk together this year, please know that the OTSCA family will be walking together virtually across the country to support the PKD Foundation's efforts in ending PKD. So together, let's walk together towards that finish line and end PKD.
Awesome. Well, hi, everybody. My name is Chad Eisman, and I'm the Chief Advancement Officer here at the PKD Foundation. Jill, thank you for sharing your story and for getting us started tonight. Just a little background about this event. This is the first time that we've all collected ourselves together in celebration of the kickoff of the walk in a virtual format. I know we tried to do a little bit of this last year, and I apologize for hopping on late. There's always technical difficulties in a virtual world, so we just kind of flex with that a little bit. But so pleased to see so many of you on here today. It's wonderful to celebrate and get started on this wonderful campaign. And as we've talked about various times through emails, and tonight we have $1 million goal. So it's exciting to try to coalesce all of our efforts towards research and fundraising for research towards a goal to cure and find more treatments for PKD. What's interesting, if you look back since we started the WALK program, coming up on, I guess this will be the 21st year, collectively we've raised over $33 million through the WALK program to support PKD research. So just think about how much each of you and the efforts you've put towards helping raise funds for the walk, team captains, donors. It's been really an incredible effort, and this program just continues to grow. And I was telling staff, we were having a town hall yesterday. The walk is really the opportunity we have more than any other event to bring together the communities and to really build a community around PKD and the PKD Foundation. And it's really inspiring to see so many people get involved with it. So something I'm always encouraged is the number of people that, whether we're virtual or in person, want to get together and support each other as a group of people. So really inspired by that. So again, thank you all for dedicating tonight and dedicating your time to be part of a successful PKD Walk platform. So real quickly, so obviously this is our signature fundraising event, as I mentioned. It's really the biggest community builder that we have in the organization. Through the support of the Walk and other fundraising with the PKD Foundation, your funds last year and beyond that have funded 19 researchers in the order of somewhere close to $3 million, $2.87 million in grants in calendar year 2020, even in a virtual world. So that's really impressive to know. And supporting the expansion of the ADPKD Registry was a big priority in the last couple of years. And so we continue to grow that. I think I heard recently we just reached 2,000 people enrolled in the registry. So again, the support of the Walk program goes to build a community both virtually and in the registry. And then we obviously are expanding our leadership role in the PKD Outcomes Consortium. Earlier this summer, we had a summit where we convened a lot of researchers, clinicians, stakeholders in the PKD community from across the world, where we got to share some ideas about what the next level of treatment might look like for PKD. So that was a very exciting event. Again, continuing the momentum and the work of the PKD Foundation. So anyway, just really pleased to see all of you on here, kind of experimenting with this first virtual kickoff. And we're really excited to have a wonderful fundraising season to support all the great work of the PKD Foundation. And glad to see y'all on here tonight. I'm going to kick things over to my colleague, Kristen Kugelman, to share a little bit more.
Hi, everybody. My name is Kristen Kugelman, coming to you from Philadelphia tonight. I'm the Senior Director of Strategic Partnerships and Community Events. I've been at the foundation for just 120 days. And to say that I'm blown away by my colleagues, the work that they're doing and advancing, as well as this awesome PKD community, it's just been an amazing couple of months. And now the Walk is here. It's full tilt boogie at the team here at PKD Foundation, getting ready to hit that $1 million goal. We are walking in all of our communities ourselves, but we have one goal, and that goal is $1 million. So my role tonight is to share a little bit about our fundraising resources, because we've got your bases covered for you to make fundraising as easy as possible. So I'm going to get to a few resources that we have. Maybe you've seen our brand new fresh look on our webpage. You can see our $1 million goal is right there. So all of us are going to do our part to hit that, along with our great national partners. And as we've said all along, 100% of these funds go to research. And that's something very, very unique to our Walk, to say to your donors, 100% of your donation goes right towards research. So that's pretty fantastic. So a quick tour of this page, because any kind of material or resource that you would need, we have it for you. Up at the top, you can see our fundraising resource, our Find a Walk. Thank you. At that, you'll find all the local walks that we have going on across the country. There's 53. This is our fundraising resource center, and this is where you can find anything you need, from sample letters, social media posts, links to download. If you've never fundraised before, there is a document here for you. I've been fundraising for walks for 20 years, and my hottest tip to share with you is use your texting groups. So like, I have my high school girlfriends, I have a group of people that I waited tables with 30 years ago, and I go and I send each one of these groups a link to be able to donate, and it's very, very successful. The greatest resource that we have for the Walk is the community events team, led by Sue, Danielle, and Ireland. They are an incredible resource for you. So if you need anything from them, they would be more than happy to help you. So when it comes to fundraising, just be bold and be brave and get started. And I think you'll be very surprised by your success. So again, 100% to research, $1 million goal by mid-October. It's pretty exciting around here. I thank you so much for being here. And now it's really on to our special guest star. And I'm so pleased and honored to be able to introduce our Chief Research Officer, Chris Rusconi, who's going to share all about the great research here at the PKD Foundation. Chris?
Awesome. Well, thank you, Kristen. And hope you all can see my screen now. Somebody nod. Anyone? Excellent. Okay. So hi, everybody. I'm Chris Rusconi. I'm the Chief Research Officer at the Foundation, and it's really a treat to be able to be with you this evening. For the next 20-ish minutes or so, what I'm going to do is share updates on our research programming. And as we walk through this overview together, my ask to you is that, just keep in mind that all of the programming and the research progress that we're going to discuss tonight wouldn't be possible without your fundraising efforts. And so our work is at the service of you and your families. It's defined by your needs. And we're focused on integrating our programming efforts to have the greatest impact we can to improve the lives of you and your families, with our programming taking the form of education, advocacy, support, and research. For this evening, we'll primarily focus on the research programming and touch on the education programming as it relates to the proposed Centers of Excellence program, which we'll share at the end of this update. So as Andy indicated, the Foundation both funds and conducts research, and we do it through 4 pillars or programs designed to improve your outcomes. That's our grant programs to improve the understanding of the disease, the Polycystic Kidney Disease Outcomes Consortium, or PKDOC, to accelerate treatments, our ADPKD Registry to improve outcomes, and coming in the future, and something we're incredibly excited about, the PKD Foundation Centers of Excellence to improve care. Each of these programs rests on a foundation of advocacy and our education programming to support and amplify these efforts. So in this presentation, I'll often generally talk about PKD and discussing our research efforts. So before taking a deeper dive, I just want to highlight real quickly some of the work we're doing in AR. So including our current cohort of grantees, the Foundation has committed about $1.4 million in AR-focused grant funding to 9 investigators since 2016. This year, we introduced ARPKD as a topic within PKDOC as a means to accelerate drug treatment for ARPKD. And we've recently formed a task force within the Foundation composed of board members, staff, community members to help us develop a multi-year research, communication, and advancement strategy to guide our efforts. So now what I want to do is take a deeper dive into our research programming. So our portfolio of programming has been built to leverage the research efforts along this continuum you see here of how research can bring benefit to patients. And so it starts with our grant program, where we're funding a pipeline of projects to increase our understanding of PKD. It then moves to PKDOC, where we fund and co-lead these efforts to accelerate drug development and to pull industry into the development of treatments for patients with PKD. It then moves on to our registry, which is us, the Foundation, engaging directly with you to conduct research and develop data sets to teach us how to best treat patients and to accelerate the enrollment in clinical trials. And finally, coming in the future, the PKDF Foundation Centers of Excellence program, which will be us again, the Foundation, engaging directly with healthcare providers and patients to improve clinical care. So now what I want to do is just basically walk through each of these programs, and we'll share what we've done and we'll share where we're going, so you can see how your efforts tie into all of this, all of the work that's being done at the Foundation. So our grants program is designed really to launch new avenues of PKD research. The program's in great shape, having moved to a sustainable annual funding model under Andy's leadership and with your fundraising efforts. And these days, what we're really focused on ways to improve the program. So the newest aspect of this program, and I see a couple of you on tonight who have been stakeholder reviewers, is the addition of stakeholder reviewers to the grant review process. And that's really to provide the patient and stakeholder voice in assessing the impact of research on patients and families. And we view that as important, not only to our funding decision, but this has become an increasing piece of other grant funding programs. So it's also a way to help researchers be more competitive applicants in other grant programs. So I want to do on the next slide is, share some statistics related to the grant program. So as Chad shared earlier, the Foundation's currently funding 19 grants with a total commitment of about $2.9 million, which is a funding level I think we should all be proud of. When you think about our grants program, it combines with our advocacy efforts, and it's designed basically for us to seed new projects And then with our advocacy efforts to provide access to federal funding to further advance this research. And so in the next couple of bullets, what I want to do is share the amazing job that the PKD researchers have done in obtaining additional funding. So first, our grantees have been really competitive in accessing NIH funds. So we look with more than 50% of them in the sort of the 2014 to 2019 cohort achieving success in obtaining NIH funding, which is a very high level of success. And right now, that in addition to other grantees, it's currently translating to more than $30 million of active NIH funding for PKD research. The other source of federal funding for PKD research is funding from the Department of Defense, and that's funding to which access is enabled directly by our advocacy work. And currently there's more than $28 million in active DoD funding for PKD research, which is, I think, truly fantastic. So that's the grant bit. And what I want to do now is move to talking about PKDOC. So along with Ron Perone, Frank Zerwick, and John Michael Sauer of the Critical Path Institute, I co-direct this consortium. And what I want to do over the next few slides is basically share what PKDOC is, what it's done in the past to advance treatments for ADPKD, and what we're doing in the present to evolve these efforts to expand the drug treatment pipeline for AD and ARPKD through the efforts of the consortium. So just here's the what. So this consortium is a collaboration between the Foundation, the Critical Path Institute, and the FDA. Now, as background, for those of you who don't know, the Critical Path Institute is a public-private partnership with the FDA formed to advance medical innovation. And so back in 2010, the Foundation co-founded PKDOC together with health authorities, industry, and academic scientists to define how to develop drug treatments for PKD, and to collaborate in the building of the tools that are needed to accelerate the development of drug treatments for ADPKD. So now I want to talk about what the consortium has accomplished and then get to where we're going. So if we go back a decade to when the consortium was founded, it identified a need for biomarkers to support clinical trials in ADPKD and collaborated in the development of total kidney volume, which I think many of you know is a measure of how kidneys grow with ADPKD progression. So they defined total kidney volume as a biomarker to select patients for clinical studies and for response to treatment. And that's led to this current ADPKD pipeline. So I think it's not an exaggeration to say that the consortium efforts are responsible for the pipeline shown on this slide. And it's worth noting that of the rare genetic diseases, ADPKD is the only one with an approved treatment. So this consortium's had a big impact on PKD. And at some level, all the products that are in development are shown on this slide are using tools developed through the consortium as part of their clinical development program. So we think that the current accomplishments of PKDOC, the ones that have been accomplished to date, will continue to be impactful in development of treatments for PKD. This has been a really successful effort. And so on the next couple of slides, I want to share what the next chapter for PKDOC, because we think this can continue to contribute to the development of treatments from you all. So we kicked off the new PKDOC efforts with the regulatory summit back in May of this year. And the purpose of this summit was really to lay out a vision of potential needs and new tools to drive treatment development for PKD and have a broad discussion with all the stakeholders, so a great group of patients, healthcare authorities, and academic and industry scientists. And as an aside, if you haven't listened to it, all of these materials are free and available. I'd encourage you, if you're interested, to go and listen to them. There's talks from patients and scientists and panel discussions that really provide a deeper understanding of these efforts. But at a high level, what the summit did was provide at least two key areas for future focus. That is, what are the tools needed to develop drugs for earlier treatment of ADPKD, and what are the tools needed to develop treatments for ARPKD? And so just to expand on both of those for a second, that current pipeline slide is really exciting. If you look at that pipeline is largely focused on treatments for patients who are at rapid risk of progression for ADPKD. So what we see a real need of is to expand the population of patients who are, for whom drug treatments are labeled. And so that would be patients at earlier stages of the disease, patients at not at rapid risk of progression, because like with a chronic disease like ADPKD, the earlier that an intervention can be deployed and the earlier treatment can start, we think the greater the impact that can have on you all not getting to kidney failure and having a longer health span and a greater quality of life. So we're really focused in the ADPKD space on tools for earlier intervention. When we look at ARPKD, essentially the largest barrier to the development of treatments is basically a lack of understanding of what's needed to approve a drug for the treatment of ARPKD. And so we see the consortium as a place where we can really collaborate with regulators and industry and academic scientists to help develop a regulatory path for approval of treatments for ARPKD and define what the tools are that are going to catalyze that. And so right now what we're doing is distilling these sort of big picture goals into areas where we can set discrete goals. And we anticipate that with this renewed consortium efforts, that it'll result in an ADPKD pipeline that's expanded for earlier intervention and an ARPKD drug treatment pipeline over that next 5 to 10 year window. So now if we move on to the registry. So hopefully many of you have seen it, but the registry annual report provides a comprehensive summary of the current state of the registry. So I'm just going to provide a snapshot of that current status and then talk about where we're going with the registry in the context of the PKD Foundation Centers of Excellence program. So the registry is approaching 2 years old. And I think importantly, we're really grateful for the tremendous engagement from you all in supporting this effort. So we released our first annual report, which is shown here back in March of this year, to share what we've learned so far. And again, if you haven't read this report, I encourage you to visit the registry homepage and download it. But in terms of engagement, as Chad mentioned, more than 2,000 patients have already signed up and are participating in the registry, making it the largest patient-reported outcomes registry in the U.S. We're currently collecting several hundred data elements through 9 patient-reported outcome surveys. These survey topics, in many cases, the survey themselves are created by the foundation in consultation with our registry steering committee and our registry patient advisory groups. And they currently cover a number of topics that include, basics on disease status and family history, surveys to understand pain and the impact of living with PKD, surveys on extrarenal manifestations of the disease, and most recently, surveys on healthcare utilization and access to help inform our advocacy efforts. And recently, we started using the registry to support enrollment in clinical trials. And over the past 9 months, the registry has made more than 3,100 patient contacts to support recruitment for 5 different clinical studies. And so, which I think we should all, again, be proud of. And this is a result of the efforts of you all and the efforts of us in being able to drive this research forward. And so I just want to wrap up this slide by saying, we're building a powerful tool to understand how ADPKD progresses and what approaches improve outcomes. And really importantly to say thank you to those of you who are already participating in the registry. If you are participating, keep completing those surveys because the most powerful data is repeated observations over time. So that continuous engagement is really critical. And if you're not participating in the registry, you have family members who aren't, please consider signing up and joining us in this effort. And so now what I want to do is pivot and talk about sort of a new effort of the foundation that we're working to launch, which is the PKD Foundation Centers of Excellence program. So the Centers of Excellence program is being designed to improve patient care by direct engagement with clinicians, expansion of the registry to help develop data sets to drive care quality improvement, and expansion of our education efforts to create a learning ecosystem really focused around care improvement. So I'm going to touch on each of these aspects at a high level over the next several slides. And what I want to do is start with a couple of table setting slides to share first the why of this program and then our vision, strategy, and objectives before we dive into a little bit more detail. So this slide highlights the why of this program and really from two prisms. First, from the patient perspective, which is there's a need for healthcare providers that understand how to treat you all and treat patients with PKD. And I'm sure that the statement in this little box is not surprising to you and that many of you have been in a situation where you know more than the physician who's treating you. So that's something that we need to solve for. And then when you look at it from the physician perspective, the complexity and the specialization of PKD care has increased with the approval of tolvaptan and available treatment. And this will only increase as more treatments become available. And so in both cases, we see the solving for this why, that including, helping you all know where to go to receive excellent care, helping increase the understanding of how best to care for patients with PKD at the physician level, and then using this education to drive that understanding through the clinical and patient community. And so as we walk through the next bit about the Centers of Excellence program, what I hope you see is that this program is going to provide us with a mechanism to address the problems experienced by patients and the problems experienced by clinicians, both at a local and a national level. So we look at the vision for this program, it's pretty straightforward, and that is we want to improve care for all patients with ADPKD by integrating a care team clinical care concept with research and education, and do it through the establishment of the Centers of Excellence network. We have a multi-pronged strategy supporting this. It involves building off our current best practices to build a care team model for PKD. It involves collecting the data needed to inform the creation of standards of care, clinical care guidelines. And, I think this is an important place to pause and say what that means. So a standard of care or a clinical care guideline is basically a diagnostic or treatment process that a clinician should use, follow for, a certain type of patient, illness, and clinical circumstance. These are data driven and derived from data, and they're available for many diseases, but not for PKD. And so what we want to be a part of creating through these efforts are national care guidelines such that any healthcare provider treating you or a family member would know how you should be cared for based on the specifics of your case. So that's a really critical feature of this program, and you'll hear it throughout. We also think there's a need to collect data to inform the health disparities in the PKD population because we know they exist. And so collecting the types of data we're talking about will help us understand gaps and what actions are needed to close those gaps. And then finally, based upon what we're learning and sort of pulling this all together, we're going to create an education program that will teach both patients and healthcare providers how best to provide for you all and drive the adoption of these care guidelines. And so what that leads to in the long term are three fairly straightforward objectives, which is to accredit and fund a network of centers of excellence that meet predefined criteria, to expand the registry to include at least 10,000 patient records with data collected both from centers of excellence and from patients, and to expand that data collection to include both verified clinical record data in addition to the patient-reported outcome survey data we're already collecting to help provide that data set to establish these national care guidelines. And then finally, to improve the care quality by providing education to healthcare providers and patients to drive adoption of the care guidelines that we're going to derive from these efforts. And so now what I want to do is get down to what's the construct of this program. And so keeping with this pillars theme, think of this program as being built on four key areas. It's clinical care, it's research, it's education, and it's community support. Now, we're not going to dive into each of these tonight, but what I'm rather going to do is I'll highlight a few pieces and frame at a high level how these pieces should work together. And what I want you to know is that while the development of this program is a work in progress, within the foundation, the shaping of this program is being driven by a really thorough diligence effort with other foundations who have been running these centers programs for a number of years, thorough diligence with ADPKD experts and stakeholders. And what we're doing is we're putting our program together based upon their learnings and then crafting it to fit the needs of the community. So what I want to do next is talk about this clinical care piece and what we mean by care teams. So this slide depicts what an idealized care team should look like for an ADPKD patient. When you look at this care team, you'll see it's comprehensive. It includes not only nephrologists specializing in PKD, but also the range of specialties such as radiologists, cardiologists, hepatologists, pain management team, and mental health professionals needed to address the potential complications of PKD from both that physical as well as mental health being perspective. And additional specialists, for example, renal dietitians, who can advise you all on actions that you can take in the immediate term to potentially improve your quality of life. And importantly, if you look at the left-hand side of this slide, the team also includes a patient navigator to help coordinate your care so that you're not the one who is trying to pull all these specialists together, and there's someone to help you navigate the healthcare system and someone to help integrate this care, the providing of care. And so it's really this model that we're intending to help develop both through site selection criteria and the site selection process, as well as direct incentives from the foundation to sites who are selected as part of the Centers of Excellence program. So just one more bit on this clinical piece, and that is for this program to have the greatest impact on you and your families, it's important that the expertise and understanding of how to deliver this care for PKD patients isn't just kept within these sort of flagship Centers of Excellence sites, but rather is broadly transmitted through the healthcare provider community that you'll engage with. And so one of the ways we envision catalyzing this is by requiring flagship centers to partner with and mentor community nephrology clinics. This could be regional partnerships with communities that are in the locale of a flagship Center of Excellence sites, or it could be national via telehealth. But the important thing is that with the advent of tolvaptan as a treatment and with the anticipation of additional treatments and an increase in the understanding of how to care for patients, all driving the specialization of care for patients with PKD, this aspect of the program that allows us to expand its footprint is going to be critical and will only increase in importance over time to ensure that you're receiving excellent care regardless of where you live. And so just a little bit on the research piece, and that's how the registry fits into this program. So the image here depicts basically the current registry data collection. And I've talked about the importance already of collecting additional data needed to define how to best treat patients. And so to expand the registry to include this type of data, we'll connect the registry directly with centers of excellence sites to collect verified clinical data and to monitor care practices. And we believe that an expanded registry data set of patient-reported outcomes combined with the verified clinical data will teach us how best to treat patients and will facilitate the development of these national care guidelines, which I think are pretty central to improving care for you all. So I just want to end by talking about, how does this all fall into the big picture? Where does education come to this? Where does the community piece fall into this? And so the foundation is unique in having access and relationships with both patients and healthcare providers to deliver education, programming, and community engagement. When you think about our education historically, it's been about direct education to patients from the foundation via PKD Connect and our webinars, which is something that we'll continue to do. And as we think about the expansion of education recently, we've begun the process of piloting certified medical education to healthcare providers to better inform them around PKD care. And so our vision for the Centers of Excellence program is to expand and integrate these efforts by providing local patient education from Centers of Excellence, as well as peer-to-peer education from these centers to healthcare providers. And so ultimately the vision for this program is to create a learning ecosystem built around the registry and around our Centers of Excellence program, where the clinical practice is informing research, research is informing clinical practice, and where we're using our education programming and our community engagement to teach physicians how to best care for you and your families, and help teach you all what the care is that you should expect so that you're empowered to advocate for yourselves when you're engaged with the healthcare system. And so with that, what I want to do is just conclude by saying, I hope you see that we're working to expand and integrate our research efforts and our education program to serve you and your families. And again, to take the opportunity to say thank you, because we couldn't do this without your efforts and your engagement and the support of the foundation. And so with that, I think I'd pass it back to Sue to moderate any Q&A.